Before diving into any conversation about mental health, it's crucial that we establish a sense of psychological safety. This means that we create an environment where people feel comfortable being vulnerable without fear of judgment or repercussions. If people are scared that there will be consequences if they speak up or share what they are truly experiencing, they're not going to do it. So how do we do this? We start by normalizing mental health discussions in everyday conversations. So for example, during team meetings, you might say, "We know this work can be incredibly stressful and it's okay to talk about how you're feeling." Leaders can also set the tone by sharing their own experiences with stress or burnout, because this shows others that it's okay to open up. This is definitely a strategy that I have used when working with my teams. I take the first step in being vulnerable and sharing, and I don't do it in a way that's uncomfortable. I don't dump my entire personal mental health journey on my team. But if I'm having a day where I'm not feeling like my best self, if I'm feeling sad, if I'm feeling anxious, whatever it is that I'm bringing in, I talk about it. I open up, and that gives my team members the opportunity, number one, to offer me support, and number two, to feel that it's okay for them to have those same feelings and share them as well. So when someone does share their struggles, I want you to recognize that your role isn't to fix this. It is to listen and validate what they are going through. I think we get it in our heads as find it, fix it professionals that when someone shares something like a mental health challenge, we have to give them advice. We have to find a way to make it better. And that is not our job. Most of us are not trained mental health professionals, so we aren't in a position to offer that help. But what we can do is we can maintain eye contact, we can nod to show that we understand, we can listen without interruption, and then we simply reflect back what we've heard. This demonstrates that we heard the individual and we're validating what they're experiencing. For example, you might say, "It sounds like you've been feeling really overwhelmed lately." Or, "Wow, that sounds really hard. I'm so glad that you shared that with me." Phrases like, "Just think positive," or "You'll get through it," are things that you want to avoid because they can really come across as dismissive, even though they're well-intentioned. Instead, what we want to do is we want to acknowledge the person's feelings without trying to solve them. It's also important when we engage in these conversations to know when to refer someone to help. This is a great time to familiarize yourself with local mental health resources, whether that is counselors, hotlines, or employee assistance programs. It's not that you're telling the individual that they must see a counselor, but you're offering to share these resources with them. We don't want to be prescriptive. We don't want to say, "Well, it's clear that you need to talk to a counselor." We just want to put it out there and offer it up as something to consider.